Hi, I'm Dr. Matthew Miller, and I'm here to share my thoughts and my game plan to open your practice even better and stronger than the way you left it prior to having to close due to the coronavirus pandemic. In addition to this video, one of the things we're going to have are downloadable resources on this page for you and your team to use as you plan to reopen your office, so make sure to download that here. The world is going to be different following the COVID-19 pandemic. Some of the things we're going to talk about today are how to recenter, refocus, and restart. So often in life, we tell ourselves, if I just had the time, then I would make these necessary changes. Well, now we have the time, so let's use it wisely. One of the first things we want to do is recenter. Start planning and see what you want to improve once you get back in the office. For example, what does infection control look like after this? And what measures are you going to have to take as you plan for your reopening? What precautions are you going to take to protect your staff and your patients? And how are you going to plan for rescheduling and recovery of this lost revenue? We're all going to have to take extra precautions to protect against the spread of the coronavirus, so communicate with your patients and let them know what you're doing during their visit to help reduce their risk. I would also advise each of you to reach out to your CPA, your financial advisor, and your bankers that you do business with. There are programs out there that may help you take care of your staff and your business and yourself, so be sure to talk to them about the SBA programs and the payroll loans that you may be able to convert into a grant. How do you plan to reschedule all those appointments that had to be canceled? Personally, I use practice performance software and patient communication software to help me with that. I use dental intel with LocalMed and RevenueWell to reach out to my patients, and I also use analytics to build my practice to make sure no one falls through the cracks. Consider offering expanded appointment hours and days for your patients. They've been out of work for a long time too, so taking off more time for dental work is highly unlikely. While patients are at your office, maximize their visit time. So pre-prep and make sure you get as much information as possible during your intake. You're also going to have to take into account a ramp-up period for goals and production. Not only do you have to take into account the startup period, but you also have to consider all the lost revenue while you are closed. I'd recommend using practice performance software like Dental Intel that can help you pull patients that need to be seen and generate helpful reports so your practice can grow. Doing these things inherently creates value and efficiency, so that allows you to become a better dentist and do better dentistry. So use this time to make the changes you always wanted to but never had the time to implement. Train your staff remotely while they are out of the office and keep them engaged to create the work environment you've always wanted. Now more than ever is the time to invest in your team. So take care of them and show them that you are there for them, to support them. Taking care of your staff will go a long way in creating value within your practice. So as we turn our attention to getting back into the office, we're going to have to refocus on the clinical aspect of things. There are going to be new PPE and disinfection guidelines and precautions that are likely going to have to be taken. I'd encourage you to look towards the CDC, ADA, and OSHA, as well as state dental boards for their recommendations and guidelines. Kavo Kerr is going to provide a comprehensive checklist that you can download as you get started. As you establish and update your new infection control protocols, make sure you have the proper PPE, check your equipment, and make sure it's functioning properly. During the prolonged closure, some equipment can become damaged or deteriorate and require specific methods for reactivation. So I encourage you to work with your dental equipment specialist and reps to formulate a good plan for reactivating equipment prior to seeing patients. Dentistry is a resilient industry, and we can lean on our manufacturers through these times. Kavo Kerr, for example, is a wonderful company. They're extending their warranty period for select equipment to help their customers should any warranties expire, equipment fail, or need servicing during this crisis. They also have recovery programs and promotions to help you reopen. As you turn your attention to restarting, create a work environment that is patient-focused, systematic, and efficient, with minimal frustration and maximum fulfillment. Understand the patient barriers and work to remove them. Typical barriers like money, time, pain, and fear are going to be heightened going forward. So take a look at the checklist and other resources on this page for some creative ways to remove these obstacles for patients. Especially now, we need to communicate gratitude and keep everyone informed about the steps your office is taking to improve their quality of care and keep them safe. Because at the end of the day, we're all healthcare professionals, so we need to do what is right by others and take care of our employees and patients. Thank you for listening, and I wish you all the best.